Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. The Honorable present to Mr. Agung and all of my beloved friends. First of all, let us thanks to Allah Subhanahu wa Ta'ala. Because of this, we are able to come in this meeting room. Secondly, I would like to say thank you for coming in my presentation. It's great to see you all. Next, let me introduce myself. My name is Syarafina Ramli Tamimi. I'm from Regular C, Diploma for Technic Radiology. Today, I want to talk to you about the dental X-ray. So first of all, let me summarize the contents of my lecture on dental X-ray. First, describe about the dental X-ray. 2. Types of dental X-ray. 3. Components of dental X-ray. 4. Basic principles how to work dental X-ray. Last is conclusion. First, about the dental X-ray. Dental X-ray are images of your teeth that your dentist used to evaluate your oral health. These X-rays are used with low levels of radiation to capture image of the interior of your teeth and gums. Dental X-ray use a shorter skin focus distance, so the dose received on the skin will be higher. An apron should be available to protect the patient from radiation. Dental radiograph using occlusal film, single emulsion, non-grid, and non-intensifying screen or IS. So, dental X-ray can help your dentist to identify problems like cavities, tooth decay, and impacted teeth. Dental X-ray may seem complex, but they are actually very common tools that are just important to your teeth cleanings. Next, types of dental X-ray. So there are two main types of dental X-ray, intraoral X-ray and extraoral X-ray. First, intraoral X-ray. Intraoral X-ray are the most common type of dental X-ray taken. This can provide a lot of detail and allow your dentist to find cavities and monitor the general health of your teeth and jawbone. There are several types of intraoral X-ray. As you can see in the slide, there are three types of intraoral X-ray. First, bite-wing X-rays. Bite-wing X-rays show details of the upper and lower teeth in one area of the mouth. Bite-wing X-rays are used to detect decay between teeth and change in bone density caused by gum disease. Next is periapical X-ray. Periapical X-ray show the whole tooth from the crown to beyond the end of the root to where the tooth is anchored in the jaw, and is used to detect any abnormalities of the root structure and surrounding bone structure. Next is occlusal X-ray. Occlusal X-ray are large and show full tooth development and placement. Each X-ray reveals the anterior arch of the teeth in either the upper or lower jaw. Next is extraoral X-ray. Extraoral X-ray show the teeth, but their main focus in the jaw and skull. This used to look impacted teeth, monitor growth, and identify potential problem between teeth and jaws. This X-ray don't provide the detail found with intraoral X-ray. As you can see in the slide, there are three types of extraoral X-ray. First is panoramic X-ray. Panoramic X-ray is show the entire mouth area, all the teeth in both the upper and lower jaws on a single X-ray. This type X-ray is useful for detecting the position of fully emerged as well as emerging teeth. Can identify impacted teeth and aid in the diagnosis of tumors. Next is tomograms. Tomograms is show a particular layer of slide of the mouth while blurring out all other layers. This type X-ray is useful for examining structures that are difficult to clearly see. For instance, because other structures are in very close proximity to the structure to be viewed. Next is cephalometric projection. This is how the entire side of the head. This type of X-ray is useful for examining the teeth in relation to the jaw and profile of the individual. Orthodontists use this type of X-ray to develop their treatment plans. Next is system components of the dental X-ray. As you can see in the slide, this is one of the dental X-ray that is often used by dentists. So first, the model is moving type dental X-ray unit, HKY shape Y. The material is metal and the type is X-ray equipment. Certification is ISO and CE. The tube voltage is 60 kV. There are 5 components of the dental X-ray plus 1 remote control. First is tube head. Tube head contains the X-ray tube and other components necessary for generating X-ray. When an exposure is made, X-ray pass through an aluminum filter that screens out unnecessary radiation. Angulation scales are on both sides of the tube head for precise positioning technique. The component is X-ray tube is tube head housing, step up and step down transformer, auto transformer, aluminum filter, and collimator. Next is arm component and stake. Enables the tube head to position or permits the passage of electrical wires from the control panel to the tube head. Next is central controller. So this is the operational controls on the control panel are covered in discussion on the operational check. And control panel have 5 major control is operated or pressed on X-ray unit. First is line switch, off and on switch, milliampere selector, kilovolt peak selector or KVP, timer, and exposure button. Next is basic principle. As we saw in the previous page, that dental X-ray have a lot of components. So now I will explain to you about the basic principle of dental X-ray. X-rays are form of radiation like light or radio waves. X-ray pass through most objects, including the body, once it is carefully aimed at the part of the body being examined. An X-ray machine produces a small burst of radiation that pass through the body, recorded in image and photographic film or spatial detector. During a panoramic X-ray examination, the X-ray tube rotates in a semicircle around the patient head, starting at the one side of the jaw and ending at the other side. Rather than relying on film placed inside the mouth, a panoramic X-ray machine projects a beam through the patient onto film or a detector rotating opposite the X-ray tube. Most X-ray images are digital files that are stored electronically. These stored images are easily accessible for diagnosis and disease management. The digital format also allows the dentist to adjust and change the contrast, brightness, and darkness of the image for better visualization of certain structure and tissues. Image on film can be adjusted or changed. Okay, this is the last material of my presentation. So I can conclude that dental X-ray are images of your teeth that your dentist used to evaluate your oral health. This can help your dentist to identify problems like cavities, tooth decay, and infected teeth. There are 2 main types of Dental X-ray is intraoral, meaning the X-ray film is inside the mouth, and extraoral, meaning the X-ray film is outside the mouth. There are three main parts of dental X-ray: is contrapannent, the extension arm, and tube head. Thank you for sticking around until very last talk of the session. Goodbye. Wassalamualaikum warahmatullahi wabarakatuh.